We've had him on many times, but it's our first time since the pandemic that we've seen Gabe Canales live in studio. He's with BlueCure.org. Hi, Gabe.
Hey, it's so good to see you guys.
So for those that don't know our history with Gabe, Ryan, why don't y'all talk about the connection and all that?
We struck up a friendship about 5 years ago. I was diagnosed with prostate cancer. I opted for radiation and hormone therapy because I wanted to, still be able to have certain functions that I was not willing to give up at that point in my life. Still not. And then I had it come back again last year and went through radiation again. And I'm okay now. Everything's fine. But Gabe has always been just behind the scenes. He's always there to lend a supporting, like a text or a phone call. How you doing? And,
it probably helps you knowing that someone's been through.
Because Gabe got it in his 30s.
Gabe was 35 years old and was diagnosed with prostate cancer. And you educated a lot of people that, look, this is not just an old person disease.
Yeah, I've lived with it for 12 years with early stage prostate cancer. Mm-hmm. And September is Prostate Cancer Awareness Month. So what does that mean? What's the message that I'm trying to get out to men and families all across our city? That is, get a checkup. Mm-hmm. Get a checkup. Have a conversation with your doctor about cancer screenings and ask about a PSA test and know your numbers. Most men don't know their numbers. And what I mean by that is know your blood cholesterol, know your blood sugar, know your blood pressure, know your BMI or your body fat percentage. Mm-hmm. And that fifth number is your PSA test. A lot of men that go to the doctor don't ask questions. They're too ashamed. They're too embarrassed. They see these numbers on paper and they don't ask questions.
We don't understand it.
And you have to ask for a PSA test. They're not going to just willingly give that to you.
Absolutely.
PSA stands for,
why is that though?
Physical?
It stands for prostate specific antigen. And
it costs more or something? Is that why they don't want to, or they just don't think you're a certain age?
So there's some issues that it's considered a controversial test. But here's why you just have to have a conversation with your physician about it. And men that are at higher risk are older men, black men, and men that have a first-degree family member, brother, son, or brother, father, that have prostate cancer.
Okay.
Now, I was 35. Mm-hmm. I had none of those symptoms, but I went a decade without a physical, with a checkup.
Which many people do in the 20s and 30s. We're not thinking that way.
Yeah.
COVID.
You're like, I don't know, I'm fine.
Blowing it off right now.
Oh, yeah, since COVID, people aren't going back to the doctor.
Now, 5 to 10% of men will have an inherited genetic mutation for prostate cancer. Most won't. Now, this may not be the case for Ryan, but in my case, at the time of my diagnosis, I was 40 pounds heavier. I had high cholesterol, and there's mounting evidence that shows that men that have hypertension, men that have high cholesterol, men that are overweight or obese, there is an association. You see that in a lot of different studies. But again, I want to get back to what we started off at the top, and that is millions of men during COVID miss their cancer screenings. Yep. Millions of men don't get their checkups. The Cleveland Clinic just released their Mention It survey. It's a national survey that showed, I think it was like 55% of men in America don't get checkups. And when you aren't in the habit of getting an annual checkup, you don't know your numbers. When you don't know your numbers, you can't make a choice. You can't do things. You don't have a baseline to go by.
Yeah.
And normal numbers, by the way, between 0 and 4 should be your
for the PSA.
Okay.
Yeah.
And what age should you do that, though? People are texting.
That's just the question, Gabe. I mean, that's a difficult one to answer.
Yeah. So
I wouldn't care what age you are. If I was 18, 20.
If it runs in the family,
I'd be like, get it.
So the American Cancer Society will say that men that have a first-degree relative or black men should get it at age 45. The standard right now is at 55. Have a conversation with your physician about it. I think all men should have a discussion with their physician, all adult men, about that. And again, I think that if you have been unhealthy, if you're honest with yourself and
not feeling good,
if you don't feel good, if you see those numbers and those numbers are high, then I think that you should ask for a PSA test. I don't want men to I look at my dad. I don't want to be like my dad takes 16 prescription pills a day. Okay, his doctor has never had a conversation with him about his lifestyle habits. My dad is recovering from stroke. He's obese. He still smokes. He still drinks. He still eats crappy food. And so when my dad told his doctor, he lives in San Antonio, when my dad told his doctor, hey, my son said I need to eat less of this junk and more of these plants so I don't have to take all these pills. And his doctor said, you tell your son I'm your doctor and he's not. But that's that's the problem that we have right now in our healthcare system. It's all transactional. It is, here's a script for a pill. There you go. when we see the number one killer for men, I don't want to digress, but this is all tied together. The number one killer for men and women in America is heart disease. Heart disease kills 11 to 12 times more men per year than prostate cancer.
Yeah.
Again, tied together. But here's the thing. According to the CDC and the Cleveland Clinic, 80 to 90% of those deaths are attributed to lifestyle, diet, exercise, smoking.
Stress.
Absolutely.
Stress.
We see that stroke, again, 80 to 90% preventable. The number one cancer killer that men have is lung cancer, 90% attributed to cigarette smoking.
Let me just interrupt you for a second
So
there, Gabe.
frustrating
For
when you
those
know
just
it and then
tuning
no one's-
in,
people
I
are
know
not
you know.
listening to it.
For those just tuning in, you're hearing the voice of Gabe Canales. He's with BlueCure.org. We met Gabe years ago when Ryan got prostate cancer. We met Gabe because they met each other. Gabe got prostate cancer in his 30s. He has a book now. It's called Unexpected Diagnosis: Prostate Cancer and the Wake-Up Call to Live Healthier and Happier. And on the back it says, "How did a young guy end up with a quote old man's disease?" And that's the whole message. And there is some red tape to how this can all work, because like you said, Gabe, what the CDC says about getting checked for cancer, for prostate cancer, and doing the test, my thing is, I've always said, for any cancer, if you have family that is 70 plus, they don't even know what their parents really died of, especially if they're immigrants, because they'll be like, oh, they died from some kind of head thing, but nobody has like real paperwork. So do you know if it's like one generation away from you or not? You got to just be an advocate for yourself with your doctor, how you feel. Tell them that I don't really know what killed my grandma. Everyone thinks she had a stroke, but who knows? She died in a village or whatever it was, right?
Yeah.
So we can only go with the information we have. Information is power, but it's also questioning yourself. I mean, you know when you don't feel good.
Yeah.
And then you stick your head in the sand like, I don't know what that is. I don't have time for that. We're going to go away.
What would you say? Like someone like me, my dad had colon cancer, died when he was 55.
Yeah.
Since age 30, I've been going to get colonoscopy. I'm getting one in October because my 5 years, it's time to do it. My cholesterol was actually decent this time, but I do take like a pill, like you said, like a Lipitor. And I know you're big on diet and everything, but sometimes it's hard for me. Like I love steak. I love Is there a feast or famine? Like you recommend a guy should just stay away from that stuff?
Yeah.
Certain meats or
processed foods you want to stay away from.
Nobody responds well to a finger pointing or wagging a finger in their face.
If you tell me I got to get rid of my bourbon, I'm gonna be like, oh. We're going to be fighting over here, Gabe. I can't get rid of that.
The Institute of Medicine has shown, there's research that shows that 97% of Americans are deficient in fiber. And I don't mean fiber from Metamucil or like a powder. I mean from plants, vegetables, whole grains, fruits, nuts, seeds, legumes. 97% don't meet the daily minimum requirement. So even if you have steak, even if you have fish or chicken, eat a lot more plants.
Put the greens in there. That was the first thing that I did when I got that diagnosis. And I changed it. And I'll tell you, my energy levels went through the roof. Yeah. Like I was always lethargic and tired and felt like crap all the time. Yeah. And when I started eating more plant-based, it really made a difference in my life.
It's made a difference in my life. Like I said, at the time, I'm 6'3". I was about 239 the year before my diagnosis. I'm about 194 right now. Mm-hmm. So, but that wasn't, my goal wasn't to lose weight. It was just to eat so that it slowed the progression of the early stage prostate cancer.
Because it's a slow moving cancer.
Yeah,
it really
mine
is.
had not escaped the prostate gland. It was early stage, low volume. I saw 6 urologists. It was the fourth one I saw in New York City, whose first question was, what is your diet? And that blew me away because none of the other doctors had asked me that. And I was like, why? And so that led to this journey. That led to this going in this direction. So what my encouragement would be is eat more plants, a lot more plants, move every single day. Manage stress levels, get 7 to 9 hours of sleep every night. And this is coming from the experts that I've had access to, the lifestyle medicine experts, the world-renowned medical experts.
You've traveled the world.
Yeah, I mean, these are guys who've done a ton of research on this, and it's not rocket science as far as just trying to. But you know what? These habits, even though they're simple, I know they can be really challenging.
I mean, look, they are, because listen, we've all heard that. We've all preached that, and we've all heard that preached to us. If it was that simple, we would all be healthy humans walking this earth with no disease. Yeah. It is very hard to kick the vices that we have. It is. I say this whether you're just dieting for weight or you're dieting to save your life from cancer.
Sucks, because I'm telling you, I went through hell with both treatments. It was not fun, and I wouldn't wish that on anybody. And if you can prevent this by simply making these changes in your life, please do so, because you don't want to go through what I went through. And what I went through is nothing compared to what other people have gone through, which is far worse.
I think people put their head in the sand, I guess.
You really do. You don't think it's going to happen to you. But, Gabe, what is the stat? As far as men, at some point in their life, almost half of us will get prostate cancer at some point.
So currently it is 1 in 8. 1 in 8 men will be diagnosed with prostate cancer in their lifetime. It goes up
1 in 8.
Yeah, 1 in 8. It goes up to, I believe, 1 in 6 black men will get prostate cancer. Black men are twice as likely to die from prostate cancer, as well as they have a higher incidence. Hispanic and black men have poorer outcomes. So it's especially important, in the Hispanic community, there is a stigma when it comes to, and black men too, there's a stigma when it comes to going to the doctor and getting annual checkups and getting these screenings, especially when you talk about prostate issues.
That area.
Yeah, it's just, we don't like to talk about it.
I feel like all men have this stigma, but it seems like it's stronger.
Yeah.
In those demographics.
Yeah.
Because I think that everyone's like, oh, that's embarrassing. What are you going to doctor for?
It's always the most comfortable for...
But it was. I got to be honest. It was no picnic getting that exam. But if I didn't get that exam, I'd be dead right now.
It helps tremendously when there's segments like this, when KRBE, when other media put a spotlight on this, and they have Hispanic men or black men or any man on their show to talk about these issues. It chips away at the stigma. But that's one of the challenges that I've confronted. I write about it in the book, how traveling the country during Prostate Cancer Awareness Month, Men's Health Awareness Month, and talking to journalists about this, they don't do a lot of men's health stories like they do women's health issues. And it's the women that constantly say, why don't we have more men's health issues in the news? Like we do breast cancer.
Well, listen, Gabe, there are a lot of women, and I've seen this, there are a lot of women who have to battle their own mates to get them to go to the doctor, and they go with them to the doctor, and they sit there and listen to their mate lie to the doctor. And then the wife has to be like...
A real man faces your fears.
Why don't you tell him the other things that we did last week that you ate or drank? You know what I mean? Like, I know this has happened for many people.
For some reason, men feel
really are.
It's like the bills. If you just put the bills in the corner and you don't pay them, but they're over there, you're not looking at them.
When I sat in that waiting room, I cannot tell you how many, husband and wives I saw together. And it's always good to bring somebody with you for these exams, because you're not going to, especially when you hear the C word, all of a sudden everything else is tuned out. You want to have somebody there that can objectively listen to what the doctor is saying. If somebody wants to reach out and because this is a good book, I'm going to read this as soon as I get home. How do people get this?
So they can go to Barnes & Noble, or they can order it on Amazon. A lot of the Barnes & Noble are sold out right now, but you can go to Amazon. Maybe you guys will post a link to it.
Sure.
Yeah.
Sure.
Yeah, but again, my encouragement is get a checkup. Get a checkup.
And ask for the right thing in the checkup.
Absolutely. Have a discussion with your physician about cancer screenings. Talk about the PSA test. Do not hesitate to ask questions. I ask a lot of questions. There's no shame in that.
You should. First of all, the doctor, you're paying him, not the other way around.
Yeah.
Ask those questions.
And by the way, is it every year you're supposed to ask for the PSA? Somebody asked that. Do you do that every year? Every year you check the PSA?
Yeah. So
is that correct?
So once you have a baseline, have that conversation with your physician. How often? Sometimes they'll have you go more than once a year.
Okay, got it.
Just depends. So it all starts with having that conversation with your physician, getting that checkup, and again, making those lifestyle changes.
And if you don't like your physician, change physicians.
You do have choices.
Because some people feel like they're not cared for.
What's your social media handles?
At Gabe Canales. GABE CANALES.
And it's called Unexpected Diagnosis, Prostate Cancer and the Wake-Up Call to Live Healthier and Happier at Barnes & Noble and on Amazon, also bluecure.org.
Yeah.
And for anybody who has missed this conversation or just tuning in right now, you can hear the whole thing on podcast.
Share it with a family member.
KRBE.com. Yes.
I'm glad for what you do. You really help a lot of people.
Thank you.
You're saving lives.
Hey, thank you guys for allowing me to share this message.
You're welcome.
It means a lot to me.
You saved a lot of lives, Gabe. God bless you.
Thank you.
Continued success with this.